I came here to the University of Cincinnati to work in a system where clinical care, research, and education were all prioritized equally. I absolutely love it here, and I think that we do some of the best work in stroke care in the world.
We're able to take outstanding care of our patients. We're able to actually educate the future of our fields, and we do this all while pushing the edge of the envelope and being the tip of the spear.
We have a lot of history of taking care of stroke and frankly being pioneers in some of the treatments that we use to manage stroke patients today.
We have one of the oldest stroke teams in the world. We've continued to grow and recruit some of the best minds in stroke. We lead the world in research.
We nationally coordinate all phase 2 and phase 3 clinical trials that are funded by the NIH that pertain to stroke patients. As a city, that is really important because EMS is coming to your door. They're bringing you right to those experts, and you're getting the care from people who are writing guidelines on how to take care of stroke patients, and they're teaching others how to take care of stroke patients.
We have tremendous strength in bringing that laboratory knowledge to clinical practice. And we can do it in stroke, we can do it in Parkinson's, we can do it in movement disorders. Most of the operations that I do today are not done the way I did them and learned them 20 years ago. That is how much technology has moved.
Our stroke team is a multidisciplinary team that all come together who truly value and put the patient first. We work very well together, but we also work with other collaborators nationally and even internationally.
We are a highly multidisciplinary team, but it only works if you are collaborative. We're always trying to elevate each other, and I think it's just ingrained. It's not something that we have to actively think about. It's default.
UC Gardner Neuroscience Institute is the one place that I have seen break all those old school silos in medicine. That is part of the reason we as a group can move science at a faster pace than other neuroscience centers in the country.
The researchers and the physicians here are writing the clinical trials that will quite literally change the face of stroke care within the next 5 to 10 years. We rely on funds from multiple sources to do the work that we need to do. And so philanthropy and research is critical to our mission and critical to advancing care for stroke patients here and throughout the region.
When it comes to philanthropy, every dollar amount is significant. Even if small dollar amount can support pilot projects, especially of early faculty or trainees. Several of those, including one of my own, frankly, we have gone on to then obtain NIH funding based on the data that we have gathered and make bigger impacts on patients' lives.
Thank you for your commitment. Without you giving back to us, we wouldn't be able to continue to do what we do.
It is through your generous support that makes our patients' lives today and tomorrow all the richer.